I'm going to call the meeting to order. Thank you for your patience. I'm going to begin with an Aboriginal land acknowledgement. We acknowledge the land we're meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. At this time, I'd like to ask if there's any declarations of interest under the Municipal Conflict of Interest Act. Seeing none, hearing none, we'll proceed. I want to make a reference to the fact that this was the last meeting for board member Ken Jeffers. His term as his appointment expires in November. He attended part of a meeting earlier today but was unable to attend this afternoon. We did honor his significant contribution and he was presented with a plaque, and I'm not sure, Mayor, if you would like to say anything, but there's no doubt that his contribution was significant. I'll turn it over to you.
Well, I would simply say, Madam Chair, thank you, that I said to Ken, and I'm happy to say it here in this portion of the meeting, that he is not only a dedicated public servant that gave a lot of his life to public service, but has continued that in his service on the police board for the last 4 years, and was somebody who, first of all, kept in very close touch with the community. It's not every board member who, those of us who are in public life in elected positions, that's part of our job, and we're out there every day interacting with the public. Ken made it his part of his work on this board to be out talking to the community and regularly reported back to us on what he heard. And that was incredibly useful. He did it in this public forum as well. But also he was somebody who was absolutely unwavering in his commitment to ensure that we're striving every day for bias-free policing, that we fought as one of many groups that can fight for an end to discrimination against anybody. But in particular, he spoke up for communities that have had some issues with policing over time, but in particular communities that have become marginalized over time, and spoke up on their behalf in a number of different respects. And so I thanked him for all of that, as I do here in public. I'm just sorry he's not here to hear that again. And I will say that somebody else commented during the course of those remarks on his sartorial elegance, but that's really not very substantive. He made a huge substantive contribution to the board, and he will be missed, and we thank him.
On behalf of the board, we officially thank Ken Jeffers for his contribution to this board and his many accomplishments, including chairing or participating in the Transformational Task Force and the Missing Persons Investigations Review. At this time, I'm going to ask that we swear in our newest board member, Mr. Jim Hart. So Jim, if you would like to join us at the front, the Executive Director, Ryan Teschner, will swear you into this board. Thank you.
Board Member Hart, I'm going to administer 2 oaths. The first is the oath of office, and the second the oath of secrecy. And if you'll repeat after me, I solemnly swear that I will be loyal to Her Majesty the Queen.
I solemnly swear that I will be loyal to Her Majesty the Queen.
And to Canada.
And to Canada.
And that I will uphold the Constitution of Canada.
And that I will uphold the Constitution of Canada.
And that I will, to the best of my ability.
And I will, to the best of my ability.
Discharge my duties as a member of the Toronto Police Services Board.
Discharge my duties as a member of the Toronto Police Services Board.
Faithfully.
Faithfully.
Impartially.
Impartially.
And according to the Police Services Act.
And according to the Police Services Act.
Any other act.
Any other act.
And any regulation, rule, or bylaw.
Any other regulation, rule, or bylaw.
So help me God.
So help me God.
And the oath of secrecy. I solemnly swear that I will not disclose.
I solemnly swear that I will not disclose.
Any information obtained by me.
Any information obtained by me.
In the course of my duties.
In the course of my duties.
As a member of the Toronto Police Services Board.
As a member of the Toronto Police Services Board.
Except as I may be authorized.
Except as I may be authorized.
Or required by law.
Or required by law.
So help me God.
So help me God.
And with that, I will sign and ask you to sign. Thank you.
Thank you.
Welcome aboard.
Thank you. Thanks, Ryan.
Thanks.
Jim, I know you're not new to this table, and I know that you have contributed in the past, and I'm confident that you'll contribute very much in the same vein in the future. Thank you. So at this time, I'm going to review the next step, which is the election of the interim chair. But prior to that, we have one item that I need the board's approval to have a time-specific hold consideration, thank you. That's item 9 on the agenda, which is request for special funds health promotion initiative cardiac health fair. Mr. Mike McCormack of the TPA has asked if he could attend today, and he is available between 2:15 and 2:45. So I require a motion to have the board entertain his presence at 2:15, between that time, 2:15. Moved by Francis, seconded by Jim. All in favor? Any opposed? Carried. Thank you. And on that note, I'm now going to go through the agenda to confirm the minutes from the meeting of September 19th. Do I have someone to approve the minutes? The minutes of September 19th? Upala, seconded by Francis. All in favor? Any opposed? Carried. Are there any holds on the presentations, items for consideration, and consent agenda? So starting with items for consideration, presentations, I have deputations on 3 and 4. Items for consideration, I have a deputation on number 8 and 9. Okay. So hearing none, I think we'll proceed then to the election of the interim chair. So on that note, I will pass it over to the registrar, the board administrator, who will conduct the election for the interim chair. Thank you, Diana Akim. I need to hold the deputations on this matter. Thank you very much, Derek. I believe you are a deputant on this item, so please come to the table.
Phew, that was a close one. I just want to say, by me speaking at this meeting, this shall not be deemed to be in any way my consent expressed or implied in doing so as fraud. God bless Her Majesty the Queen, and long live Her Majesty the Queen. And let the record show, as person is defined as a corporation in the Legislation Act of Ontario. If I've ever led the Toronto Police Services Board to believe in any way that I am a person, then that would be a mistake, and that I ask all of you to please forgive me. So one thing for whoever's going to be the next chair to take notice of what it says in R versus Boulanger, 2006, the Supreme Court of Canada said, the purpose of the offense of misfeasance in public office, now known as the Section 122 offense of breach of trust by a public officer, can be traced back to the early authorities that recognize that public officers are entrusted with powers and duties for the public benefit. The public benefit is entitled that public officials entrusted with these powers and responsibilities exercise them for the public benefit. Public officials are therefore made answerable, right? Because that's been a bit of a problem here in the past. Public officials are therefore made answerable to the public in a way that private actors may not be. And respectfully, is it too much to expect that the next chair of the Police Services Board, when they say to the rest of us, you know the rules, actually knows the rules themselves? Now, Councillor Nunziata here and Law Society member, Executive Director Ryan Teschner have already heard me say this at Civic Appointments Committee, but I have here procedural, but this is from your own procedural bylaws here that I'm going to read from. Section 1.5 says, the Toronto Police Services Board wants to ensure that the application and interpretation of the procedural rules contained in this bylaw are consistent with the principles set out above, which is 1.4. The Toronto Police Services Board wants to ensure that those rules reflect the principles of accessibility, responsiveness, and accountability to the community, fairness, respect, and full debate in the conduct of its meetings, and flexibility in responding to changing circumstances at meetings of the board. Now, because in law, every definition is dangerous. In civil law, especially, definitions are dangerous. The definition for responsive, because you guys mentioned responsiveness in your own bylaws here, in Black's Law Dictionary is defined as responsive, giving or constituting a response, answering. Accountable is defined as responsible, answerable. Answer, the verb form, is defined as to respond to a question. See a pattern developing here? Now, this is also, I mentioned this last month, this is from the Toronto Police Services Board's own website. Who is the board accountable to? The board is accountable to both the community and to the Ontario Civilian Commission on Police Services, even though they're not called that anymore. And again, accountable is defined as answerable, answer to respond to a question. So at this point, I have to ask myself whether or not I've been drinking because, again, the Black's definition for instructed delegate is a delegate bound to vote according to a constituency's expressed wishes. So I appoint the Toronto Police Services Board to act as the trustees for me in this matter, as it is my express wish that Mayor John Tory be the next chair of the Toronto Police Services Board. Take notice, my instructions are for the Toronto Police Services Board to nominate Mayor John Tory its next chair, barring any objections, of course. And now I know this will only be for 3 months, and then you guys vote again all over at the beginning of the year for a full time. So are there any objections? Going once? Any objections? Going twice? Third time, are there any objections? Let the record show that there were no objections to Mayor John Tory being the next chair of the Toronto Police Services Board. Because quite frankly, I just want to see if he's going to lie to me in front of Chief Saunders about asking questions here at the board meetings in the future. Another reason why Mayor John Tory should be the chair of this police board is because when he ran for mayor, many people don't know this, but he had his own code of conduct. You can't find it on the internet anymore. It's being deleted. But his code of conduct said, making City Hall more functional means making sure council is accountable, answerable, and
Mr.
working...
Moran, I don't think this part is relevant. Thank you.
Well, why isn't it relevant?
You have 1 minute. Thank you.
And the crown is the surety for Mr. Moran, the person I have. Making City Hall more functional means making sure council is accountable and working for you. Toronto's elected officials work and answer to you, not the other way around. And he also mentioned the code pledges to run an open government, emphasizing the basic democratic requirement for having elected officials answer questions publicly. We work for Torontonians, not the other way around. You're paid by the public, Chair Mulliner. You work for us, and I do not consent to how you just interrupted me there.
Thank you. So at this time, I'm going to return to canvas for holds, and I will walk you through the items that do not have deputations, which are all automatically held, just in case I didn't catch all of the requests. So turning to the presentations, we have deputations on 3 and 4, so those are held. Items for consideration, number 5. Do I have a hold for 5? Which is recommendation for board ratification of collective bargaining settlement with the Toronto Police Seniors Officers Organization. If not, can I have a motion? Mr. Hart, approval. Mr. Tory, all in favor? Any opposed? Carried. Thank you. There's a motion for number 6, so we'll hold that. Number 7, new job description, team lead, internal communications, corporate communications. Do I have any holds on that? No. Do I have a motion to approve? Mr. Hart, Mr. Chandrasekhara, all in favor? Any opposed? Carried. Thank you. There's a deputation on number 8, deputation on number 9. Moves us to the consent agenda to receive. I have number 10, City of Toronto Council Decision Cycling Network Plan Update. Do I have someone to move to receive? Mr. Hart, Ms. Chandrasekhara, all in favor? Any opposed? Carried. Number 11, City of Toronto Council Decision Downtown East 2023 5-year Action Plan. Motion to receive. Ms. Number 12, we have a motion, so that's held. Number 13, Chief's Administrative Investigation into the custody injury to Mr. Lawrence Newton. Do I have a motion to receive? Mr. Hart, seconded by Ms. Chandrasekera. All in favor? Any opposed? Carried. I believe that takes us then to the election of the interim chair. So at this time, I'm going to turn it over to the board administrator, Ms. Diana Akim, who will take over the proceedings.
Good afternoon. In accordance with subsection 7(2) of the Police Services Act, which states that if the position of the chair becomes vacant, the vice chair, if willing, will act in his or her place and assume the position of chair for the remainder of the term until an election is held at the first meeting in the calendar year. If the vice chair assumes the position of the chair, an election will be held for the position of vice chair at the next regular meeting. If the vice chair declines to assume the position of chair, the members will elect an interim chair in accordance with the procedure set out in Section 5 of this bylaw. Notice was provided that Vice Chair Marie Moliner has declined to assume the position of chair for the remainder of this year and until an election in January 2020. Notice has been provided in the agenda, and an email has been circulated from Vice Chair Moliner. Therefore, in accordance with that subsection, now nominations for the position of interim chair will be accepted.
Madam Secretary, Madam Interim Chair, I nominate Jim Hart to be the interim chair of the Police Services Board for the remainder of the 2019 calendar year.
Thank you, Mayor Tory. The nomination has been accepted. Thank you. Mr. Hart, would you agree to be nominated?
I will second the nomination.
Oh, thank
Thank
you.
you.
Mr. Hart, do you agree to be nominated as an interim chair for the remainder of the calendar year until an election is held in January 2020?
Yes, I'm willing to serve. Thank you.
Thank you. And since it has been seconded by Vice Chair Moliner, thank you very much. Are there any further nominations? No. Thank you. Hearing none, nominations will be closed. Mayor Tory has nominated board member Jim Hart as the interim chair for the remainder of the year, and it was seconded by Vice Chair Marie Moliner. All in favor? Thank you. Any opposed? It has been carried. There have been only one nomination for the office of interim chair. Mr. Hart is elected as the interim chair for the board for the remainder of the year until the election in January 2020. Thank you very much.
Thank you. Your seat is warm. Would you like to take it? You don't want my water. It's okay.
Thank you very much. I'll be very brief, as I always am, but I would just like to start by thanking the members of the board for trusting me in this very critical role. I'd also like to tell the chief and members of the service that I very much look forward to working with them, and I have the utmost respect for all of the work that you do. And to the board staff, I can't wait to work with all of you, because I know every single one of you are top-notch individuals. And I'd be remiss not to mention former Chair Andy Pringle, who I think just did an absolutely stellar job. I've got huge shoes to fill, and all I can say is I'll do my best. Thank you. So now we can move on to the agenda. Item number 3, which is the Toronto Police Service Mental Health and Addictions Strategy. I believe, Chief, we have a presentation.
That's correct, Chair, and I'll have Inspector Chris Boddy do the presentation.
Okay, good afternoon, everyone, and congratulations, Mr. Chair, on your new position. So just to give a little bit of a background on the mental health strategy. So you board members will recall back in 2016, the board struck a external advisory committee to look at how the Toronto Police Service officers interact with people in crisis. And this was right after the Yakabuchi review that we responded to in 2015. So moving forward, we met extensively with then known the board's mental health subcommittee on what a mental health strategy for the Toronto Police Service would look like. So keep in mind, this journey started over 3 years ago, and that was because the service wanted to have extensive consultation with members of the community, not only members of the board subcommittee, but throughout the city of Toronto, and even community members that really had no attachment to the mental health field or members of the Toronto Police. So 3 years later, we're here with what I believe is one of the most unique mental health service strategies that has been developed by certainly any police service in the province or likely Canada as well. And one of the other unique things is that when we were doing some benchmarking and looking for best practices back in 2016, late 2015, one of the things that I noticed is that there wasn't a commitment from the Police Services Board showing their commitment to not only the members' mental health, but also police officers' interaction with people in crisis. So if you look at the second page of this strategy, you'll see it very clearly that both the service and the board thinks that the wellness of our members is very important, and also feels that the interactions that police have with people in crisis are a top priority. And I really feel that when the citizens of Toronto read this document, it'll be very clear that both the service and the board are partners in the mental health community in this city. And it reaffirms to our officers as well that both the service and the board thinks very importantly about our members' mental health, because of course we all realize that a healthy member makes for a better public servant. So I don't know if Ms. Chalasandra, if you wanted to speak on some of this. This was a partnership between the service and the board.
Great, thanks so much. I was very pleased to be present for the launch of the strategy, which happened about 2 weeks ago, and it was during Mental Illness Awareness Week, so it was really great to commemorate that week. As Inspector Boddy was saying, this document, it's the first strategy of its kind for the Toronto Police Service, and it was the result of years of dedicated effort, considerable community consultation, and a distinct recognition that how our police officers respond to people with mental health and addictions issues is one of the most important priorities, not just for this organization, but for our city. And this strategy doesn't only support members of the community, it also shines a light on the importance of mental health and wellness for the members of the service. So this document is both inward-facing and outward-facing. What's really important is that through this strategy, the Toronto Police Service has made a great commitment to supporting the residents of our city who live with mental health and addictions issues, and simultaneously made an ongoing commitment to enhancing and promoting mental health and wellness in the workplace. And I was just so pleased to be part of this process. I had a front row seat to how it all unfolded over the past 2 years. And I wanted to take a moment to thank, I have a long list of thank yous that I want to give just for everyone who supported us in getting to today. So at the top of my list, I want to thank the Chief. Thank you, Chief, for your leadership in ensuring that interactions between the police service and individuals in crisis are characterized by understanding and compassion, and also for your bravery and willingness to shine a light on mental health challenges that service members face on a daily basis. That takes a lot of courage, so thank you for that. I also want to thank key leaders in the service for being champions for this work, and especially Deputy Ewan, Deputy McLean, and Deputy Coxon. It's so important to have the leadership and those champions across the service carrying this forward. And I really want to thank all the members of the service that dedicated their time and expertise to the formation of this strategy. There were many over the last 3 years. I'm really pleased with the final product. I also want to thank the many members of the community. I want to acknowledge them and thank them for their input and support for the strategy, and some of them are here. So I'll start with the members of the board's previous mental health subcommittee. It was co-chaired by Pat Capone, who chaired that committee for almost 10 years and really laid the foundation for this work in early days. Next is the members of the board's previous mental health external advisory committee, including the co-chairs Dr. Dorothy Cotton and Hamlin Grange. It was that group that really recommended that the Toronto Police Service build this strategy and really kickstarted this work. And then also the members of the board's new mental health and addictions advisory panel. I see Susan Gafka's here, thank you for coming, and also Dr. Eileen Davila, who's also here. I'm so pleased to co-chair this panel with Jennifer Chambers and Steve Lurie, and I feel so honored to be surrounded by these individuals leading this work for the board. I also want to thank our legal team, because I have to say over the years we've relied on you a lot, so thank you, Jane, and also to Fred Fisher and to Scott Nowoselsky. Really important, because there's a layer of legal expertise that's needed to develop any kind of strategy. I also want to thank the board office staff. All of this work can't happen without you, especially Ryan, and to Sandy, who's been doing this work for almost 10 years in support of the mental health subcommittee. I need to acknowledge the past two board chairs, both Alok Mukherjee and Andrew Pringle. They were both incredible champions for mental health. And so, Mr. Hart, no pressure. I'll be looking to you for your leadership and guidance as we move this important work forward. And finally, but most importantly, I want to thank you, Inspector Boddy. You have been tremendous. There were many, many, many versions of this document, and you were so diligent and patient and ensured that everyone that needed to be consulted with was consulted, both in the community as well as in the police service. And this would not have been possible without you. So thank you so much for your support.
Mm-hmm. Thank you, Inspector Boddy. We have a deputation on this matter, so if you could just take your seat, then we'll hear from the deputant and then bring you back. Brenda Ross. We'll start the clock whenever you're ready. Just let me know, Brenda.
Thank you. Go ahead, start the clock.
Okay. Welcome, Brenda.
Thank you. There's one thing I want to bring up. I mentioned last time when we were talking about suicide prevention that if my request, my suggestion, wasn't agreed to by the board, that I would be bringing the matter up again. And so I do want to bring the matter up again. On October the 10th, the Sun newspaper reported there had been another suicide in the Toronto Police Service at the end of September 2019. So I again would like to urge you to think about my suggestion that I've made twice before that I feel very strongly about. I believe it's the only thing now missing from the new strategy that everybody's talking about. I believe it's the one missing link that we need so that I feel confident that I'm not going to read again about somebody else's needless suicide who's a policeman with the world to look forward to. Given that you have high wages, great benefits, camaraderie, and all kinds of perks, I don't want to think what was the reason that somebody had to commit suicide and there was no one to stop it. So here again, for the third time, I want to give the same suggestion I've given before, and I'm going to tell you that if you still do not agree, the next suicide, I'll be right back standing here if I'm still breathing, and I'll be saying it for the fourth time. I believe that we need, the only thing missing from this new strategy is an aggressive outreach worker. And I've tried to explain, after Mayor Tory asked me to explain, what is the difference between an outreach worker and an aggressive outreach worker. The difference is, what you may have in your mind about an outreach worker is not an aggressive outreach worker. It's two totally different ways of behaving and doing things. An aggressive outreach worker does not take no for an answer. You don't have a choice. They're in your face till you comply, until you agree to cooperate with them. We don't stand by idly while someone decides they're going to take their life. We do what we can to the best of our abilities, and we go the extra mile. And because we do that, we build morale. People know that that's the way it is. Very bravely and courageously, Deputy Policewoman Barbara McLean very kindly told everyone that she had contacted health services when she had a problem. And it was very kind of her, but some people aren't as brave as she might be, and they don't want to contact health services, and they don't want to contact Beyond the Blue. So when people don't want to contact you, for whatever reasons, you go to them, and you make yourself available. And you take phone calls from people that will tell you what is wrong, anonymously tell you something, and then you act upon it. So Mayor Tory asked me to explain this once before, and I've tried to explain how it works, but very specifically, you do not take no for an answer. So then you can say to yourself, and I hope this doesn't happen, but after you do this last step, if anyone else should commit suicide, you can at least say to yourselves, we left no stone unturned. We did everything that any human could do. We did the best we could. We tried to take care of everyone, and sometimes we'll fail, and that's just the way it will be. But sometimes we will succeed. So the suggestion very clearly, I'm asking you to either now or on the next agenda add to this new mental health strategy that you, Paula, just finished saying so many people have worked so hard for, so many people wanted to see. We add the last link to the strategy, which is this one more position. And with all the new hires that we've done and all the money that you have for parties, parades, pickle barrel food, and dry cleaning, and all the rest of it, how about we do the one thing that nobody else has done, and we add this one new position to the roster of jobs available, keeping in mind that this person won't be like anyone else who we've already got. They'll be very special. They'll be available 24/7, and they'll take no no's for an answer. There's no such thing as no. And that leaves us, I believe, if I was a policeman or police lady, I would say to myself, well, there's nothing left for me to ask for. We've got it all. So please do take this seriously this time, but if you don't, I will be back if there's another suicide. I'm not letting this go. I believe it's very important to the public. As you just heard this policeman say.
Thank you, Ms. Ross. Your time's up.
Thank you.
Thank you very much.
Thank you.
Chief, can I ask you to comment on Ms. Ross's deputation?
The wellness factor for our employees is one of the most serious issues that we continue to discuss, and we continue to look for best practices around the world on a regular basis. One of the issues that we do have really when we deal with the charter is compelling people. There are certain circumstances when you can compel by law, and there are more times than not you cannot. So that plays a factor in a lot of our decision-making processes, as well as any of the methodologies that we use when it comes to the wellness of our officers. The collective approach, though, working with other agencies is also critical. I'm glad that we do have the subcommittees, because these are discussions that are had. There's no stone unturned when it comes to the discussion, and I think that provides a healthy opportunity for us to learn and grow collectively.
Thank you, Chief. Inspector Boddy, can I bring you back, please? Thank you, Brenda.
Thank you.
Board members, do we have any questions of the inspector? Marie?
Congratulations, and congratulations to all the folks that you very thoughtfully included in your remarks. Ms. Chandrasekhara, I'm really pleased to see this in writing, and I think that the paper is worth something. I know that the action items on page 11 are essentially the backbone of next steps, and while I don't believe they're ordered in any particular order, there's a lot here. It would be good to know two things. Do you have a sense of what the top three are, and what timelines might be if you were to be told start tomorrow? When would it end?
So as far as responding to the action items?
Yes, so you have a list on page 11. Would you like to have them in front of you?
Right. So actually, if I could back you up, I thought maybe I didn't explain this. So if you go to the page number 6 at the executive summary, it speaks to the 8 areas of commitment that the service is committed to reporting out on every year. And deliberately, the very first one is preserving life. But we're committed to annually responding to all of those action items in that document.
I'm just very practical. So if there was, and I'm not trying to put you on the spot, I'm actually curious, if there was one thing that you thought, you know, if I had my choice, I would focus on this one right away. Is there a particular area that you would focus on? And if so, how long would it take you to achieve what you think is the right resolution or completion of that particular part?
Not exactly sure how to answer that. I mean, all of it is important. That's why it's all in the document. So, I mean, you know, the number one thing that we train our officers when we're out in the community, when we're dealing with people in crisis, is de-escalation. So every year or every 12 months, our police officers attend our college and they receive training on dealing with people in crisis, and that's heavily weighted in de-escalation. So you may recall back in 2015, the Toronto Police Service was the first service in the province to teach our police officers negotiation skills. So people typically think that was for like SWAT teams or emergency task force services type folks, but these are our frontline police officers getting negotiation training, and negotiation is de-escalation. And you know the number of calls that we receive every year, over 30,000 calls now police are responding to with people in crisis, and very, very rarely is use of force used in all of the interactions we have with community members. And keep in mind too that when people call the police, they're calling us because there's a safety concern generally. So if somebody falls and breaks their arm, they don't need the police. We have other people that can look after that. So if you take that into account and all of the calls for service, you know, I can say that very rarely do police actually use physical force on individuals.
Thank you, and I actually think that the focus on de-escalation is perhaps the most significant piece of training in relation to a number of policing initiatives, but mental health, so thank you very much.
Any other questions?
Sorry,
Opala?
maybe I could just add to Marie's question here. In terms of the board's new mental health and addictions advisory panel, the idea is that everything you see on page 24 in terms of the measurable outcomes, that panel will get to see, and then the board will get to see. I believe we landed on an annual report to the panel and to the board, but the measures that you see here are things that can be measured today, and we're very intentional in kind of building it ground up from what's measurable today, as opposed to having a blue sky list that you might not be able to measure for years. This is something for sure that's measurable today.
Thank you.
Mayor Tory.
First of all, thank you for your work, and thanks to my colleague, Ms. Jennifer Sakara, and also all the people that were involved in putting this together. I just had 2 questions, because I was talking to the media outside, and we were talking about advocacy to the other governments, and on the section, in the section on advocacy, there are 2 things mentioned I wondered if you'd just comment on. First, with respect to the mobile crisis intervention teams, it's mentioned here that we will look at trying to expand that, and I think maybe if you had a comment on kind of expanding it from where we are to where we'd like to be, just in terms of the stress and strain on that proven effective system. And secondly, the emergency rooms. I mentioned out there is a particular problem in that there's a lot of people being taken there by the police, and that's not a place where they can get proper treatment. And you talked there as well about advocating to and with the emergency department people in the hospitals, and if you could just address those 2 things since they're in the advocacy section.
Yes, so thanks for the question. So 7 days a week, we have 10 MCIT teams throughout the city of Toronto. They operate around 1 p.m. to around 11 p.m. because that's what our data shows is the largest calls for service. However, we respond to about 80 to 90 calls per day for people in crisis, so we're never going to have enough MCIT officers, like MCIT teams. But what I can assure the board and the community is that if you call the Toronto Police, you're going to have 2 police officers that attend there that are well-trained, professional, empathetic. They're wanting to help. As far as expanding the teams, of course, the nurses aren't employees of the service. They're employees of our partner hospitals. And of course, as we know, the LIN funds the nurses. So without more nurses, it's impossible to actually expand the teams. But I'm very confident that our police officers are able to respond to these calls effectively, safely, and you know, like I said, we're never going to have enough MCIT teams. The more, the better. But I'm confident that right now we've struck at a good balance. But we are always going to try to expand that program because it's been evaluated on a couple of different occasions, and on both of those evaluations, it's suggested that the experience that the client had was much more beneficial having a nurse and a police officer as opposed to two nurses, as one might expect. As far as wait times in the EDs and the emergency departments, so right now our police officers, if they're in a position to apprehend an individual, the average wait time is about 97 minutes. So we have two expensive police officers waiting in the ED with a client that would be better served if the individual was immediately admitted. But I tell our police officers that even though there's an hour and a half or so wait time, that doesn't have to be time completely lost. That's time where the officers can build a rapport with the individual, because we know that oftentimes people in crisis, they're going to be calling the police again. So if that interaction in the hospital can be a good positive one, that individual is going to remember that the next time that the police are called to his or her address. So, you know, it does take a lot of time and it costs a lot of money, but it's not wasted time. But we have been working closely with our partner hospitals to try to reduce that wait time, and then, but it's a work in progress.
Any other questions? I just have one myself, Inspector Boddy. As I read through the report's a terrific report, but lots and lots and lots of action items. And I know you've done yeoman's work in terms of the volume of issues that you've handled and the work in this report. I just wondered, do you have a team that works with you on delivering these action items? And do you have a structure that's going to make this happen? Because there's a tremendous amount of work here.
Yeah, so we are going to put together a team to tackle these action items. I will say that since we've begun this journey 3 years ago, some of these action items we actually do capture. We just don't bundle it up as we want to as we report out in this yearly, but it's a bit of a monumentous task, but we'll make sure we get it done.
And just in closing, Upla, you thanked everybody that I had on my list, so I kept checking them off, but I just want to reiterate thanks on behalf of the board to you for being the board's lead on this file and doing terrific work. And I know Chair Pringle had a vested interest in this and would want to be here, and in his absence, I thank him if he's looking. Thank you very much, Chair Pringle, for all of the work that you put into this file. Can I have a motion from the floor to receive this item? Ms. Chandra Casera, seconder. Marie, all in favor? Thank you. I'm going to change the order just for a second because we have a timed item on number 9. We have a deputation from Mike McCormack. So Mike, if you could come forward and give us that deputation right now. And the item is request for special funds, health promotion initiative, cardiac health fair. Mr. McCormack?
So it's a little awkward fumbling around these days, but I'm getting used to it. So thanks for the opportunity. It's a great opportunity to represent the TPA on this matter, the cardiac health care screening potential. And sorry if I've got a little bit of a lisp, but I had to have a tooth. Anyhow, long story. Tooth, finger, I'm falling apart. What can I say? So it's no surprise. Well, we'll get there. So no surprise to anybody that our members work in a very high-stress environment, and sometimes that the career choice or the calling or the vocation, as our officers and civilians refer to it, lead to health issues that may go undetected, including heart disease and mental health issues. And this is an issue that is at the forefront of policing all around the world right now. We've seen presumptive legislation around PTSD, the effects of stress in the workplace, the impact of undetected health issues on the wellness of our members, and their ability to provide service to the citizens of Toronto. This has been recognized recently in findings from an expert panel on police officer deaths. Not only the stress of coming to work every day, the stresses around workload, shift work, staffing issues, and this is something that the TPA has been cognizant of for a number of years and a huge advocate for our membership. I'm a third-generation police officer, and I've seen a change in the policing culture where health issues were never discussed or recognized in the past, and I've seen a paradigm shift around that. Never has it been more relevant than today that we have all the science and data that now supports what is really happening to our first responders and the toll on our first responders. We have a rare opportunity here to join with the University Health Network and with the TPS to screen members for signs of early heart disease and mental health issues. I cannot say how grateful the TPA is to the Peter Monk Center and Dr. Rubin, the Toronto Police Service Board and the Toronto Police Service for this opportunity to join together and deal with this very important issue. I was an outpatient at the Peter Monk Center for several years. Early detection may have saved my life. I was largely asymptomatic, and the doctor's early detection found signs of heart disease, which I had treated with 2 stents. So that's the answer to your heart problem. So I'm getting there. So now we have that ability for early detection for heart disease, mental health issues, that we can improve the health and wellness of our members. And this improves the overall lifestyle, the quality of life for our members and the service, makes for better employees and a service of excellence. The TPS often talks about being a top employer. Well, this is another opportunity to show just how the TPS and the Toronto Police Association, the Toronto Police Service Board, take care of their employees and their members. We're always running in when others are running out, seeing people at the worst circumstances, and this takes a toll on our members. This is an amazing opportunity, as I've said, and the TPA is fully committed to the success of this program. We are honored to be partnering with the Toronto Police Service Board, the SU, the TPS, and UHN to address this critical issue. We want to thank the board for their commitment to programs like these that make our environment better for our members, but make the city of Toronto a better place to live and a better place to work. However, the service could not contradict the benefit of these programs by moving away from a health and wellness position to a return to work policy that prioritizes costs over the health and wellness of our members. The key to success of this program or any other program starts at the top, and the tone must be at the top. And we must ensure that our members get the help that they need and the help that they should have. The stigmatization of mental health and members' well-being must be a priority for the service, command, the board, and the TPA, and it must be something that we all combat so that our members feel safe and comfortable to get the help that they need. Thank you for your time.
Thank you, Mr. McCormack. Any questions of Mr. McCormack? Yes, Councilor Nunziata.
So the cost of the health care is $10,000, correct? And so there'll be a partnership with the 3, right? Now, can you tell me, you're having, the pilot will be at 3 different locations, right?
Right.
Throughout the month of November.
Right.
Not at the same time.
No, throughout the month of November.
And so how would that work, being at 23 Division and 51 Division?
Well, again, like in order for us to look at the sustainability and to do a proper evaluation, it's piloted, so it's going to be done there. And again, the members have to feel safe that they can volunteer to go. It's one thing to go in and have these programs, But if there's no uptake on these programs, and that's why when I talk about stigmatization and the ability to break down those barriers, that is so important, but to get out there and have the members feel comfortable, because I can tell you, and I've been around for over 30 years, and the culture, and we're all supposed to be tougher, and we're all supposed to be taking this on, but we see that toll. But so I think that this is a great way to start it, to get the pilot out there. But this is, we often talk about Toronto Police Service being on the cutting edge or the excellence. This is a great opportunity to show that, and this is unprecedented.
So when you say health fair, because I'm not, maybe I can explain it a bit. They'll be at the divisions, like going around, like they'll be, like where, explain to me how that would be done.
Right.
If it's
Well,
done at a division, like where would it be? Would it be in the lobby? Would it be, like, how does that work?
Well, again,
Okay.
going through the logistics, the members
Yeah.
would do a health risk appraisal, something that, we are fortunate that UHN has developed around first responders and looking at that. And then from there, they would fill out the forms and look at that, and they would then be put into categories of either a high risk, a low risk, or other types of risk, and they would be streamed into where they would be getting the resources where they would need, and the officers and civilians would be taking the uptake on that. So whether or not they would, once they get streamed into that, filling out that and being there, going through the process with our officers.
Okay. Thank you. I just wasn't familiar
Yeah.
with the way the
Yeah.
process was going to work. Thank you.
Chief, did you have something to add?
Yeah, sure. I'll echo what the president is saying. This is a very exciting opportunity, and we're looking very forward to working collectively to make sure we do get this right. That early detection piece I can't speak to enough. I've been there myself. So I'm glad that we're all on board with this and excited that UHN is going to be a strong partner with us. The operational components of it, Deputy McLean and Ivy would have a much stronger ability to lay it out so the board has a comprehensive understanding of exactly what it would look like. And I think that this is going to be something that will definitely take a lot of traction, because I guarantee you that the command, as well as the president, will be pushing this very strongly to the members of the service.
And Councillor Nunziata, when this proposal was brought forward to our board, and we were talking about what that process is, about taking part in that, every member of my board had their hand up right away. Could we volunteer to be first in line for this? Because again, when I talked about my own circumstance, I was asymptomatic. I had nothing that told me that there was any issue, and yet, a couple days later, I had 2 stents being put in my heart. So this is imperative, the early prevention, and not only for, like I said, the benefit of our members and their lifestyles, but for the police service, making them productive and good employees going forward.
Yeah, no, I agree. It's just I just wanted you to explain the process, because I wasn't aware of how it was going to work. I know health fairs be health fairs, but, but thank you, and I'll be glad to move the recommendation.
Before we get there, Mayor Tory?
Well, I just want to thank Mike for coming and saying it particularly agreeable today. But I just wanted to tell you that when I was running a law firm, in the 5 years I was running it, we had one of these. And twice in the 5 years, somebody just had their blood pressure checked, because that's part of what they did. And twice in the 5 years, those people were told to go straight to the hospital, were taken to the hospital because there was an undetected blood pressure that was so severe that people were worried they could have an episode at any moment. And so that's why you do these things, because it's the undetected cases. And so I'm glad that it's a partnership with UHN and with you and with the service. And I think it's a tiny price to pay for this pilot. And hopefully it can be expanded across the service. So thank you.
Well, again, thank you, Mayor. But looking at this, I'm hoping that we've had conversations with the Canadian Police Association about expanding this program nationally. And I've got a guarantee from UHN they're going to do a better job than they did on my finger. So that's on the upside.
Thank you, Mr. McCormack.
Thank you.
Any questions on the report itself? I just have one, Chief. Mr. McCormack mentioned uptake. How is the service going to measure uptake?
If I could have Deputy McLean.
Yes, so this is a pilot, so we've chosen the areas so that we could spread it out across the city, and we will be measuring participation. So that's the first piece. We have to understand that there is a confidentiality piece for members' health. but we will be measuring the participation of members, taking that back, and then seeing if we get enough of our participation that we will be expanding it. So this is just the first of many. So often you've heard me sit here and talk about the mental health aspect of our wellness. Now you're starting to see the physical wellness of our members. So this is the first of what we anticipate to be several aspects of members' physical wellness.
Thank you, Deputy. I think we have a motion to put on the board. So we have a motion that the board approve the expenditure in the report as an exception to its special fund policy, given the significant public interest in raising awareness and addressing cardiovascular health risk factors with respect to an issue that affects the health and well-being of service members. Can I ask somebody to move that motion, please? Councillor Nunziata, somebody to second. Marie, all in favor? And on the report, all in favor? Carried. Thank you. Now we can go back to the agenda item where we left off, and that would be agenda item number 4. And we have a presentation from the Medical Officer of Health, Dr. Davila. Welcome. How are you?
I'm very well.
Good.
Thank you very much, and congratulations, Mr. Chair.
Thank you.
I believe the presentation is just being called up, and it's there on the screen in front of you. So first of all, thank you very much to the board for allowing me to be here. I think I might need to move this a little closer, for allowing me to be here to present to you today. And it is my pleasure, my extreme pleasure, to be here today to present to you on a recent health status report that we produced at Toronto Public Health called TO Health Check. I have to comment, though, I can't resist. This is a very health-focused agenda for a police services board, so I'm going to continue in that vein for now, although it is a slightly different vein. You've heard a little bit about mental health. You've heard about specific individual clinical screening, all of which are important. I'm going to take you down the path, though, of public health, a slightly different branch, but no less important. And if you were to ask me, I would tell you it's far more important in respect of health. And I'm hoping that you'll see by the end of this presentation why I would say that public health is, in fact, far more important in respect of the conditions that actually create and maintain health, and I would argue as well, well-being and safety in our city. So with that, if we can turn to the first slide. Again, just for those of you who are less familiar with me as a face here at this board, I'm Dr. Eileen Davila, and it's my honor and privilege to serve as the Medical Officer of Health for the City of Toronto. In this capacity, I lead Toronto Public Health, Canada's largest local public health agency, and we're actually comprised of about 1,900 staff working from locations all around the city. And it's our role to provide public health programs, services, and functions to all 2.9 million residents of our fair city. I told you a little bit about public health and how it's different from the other aspects of health. I can tell you that most of my colleagues in the practice of medicine treat patients individually, and they tend to treat patients after they get sick. Our role in public health, my role as a public health physician, is to actually improve the health of the whole population, not one at a time, but subpopulations and groups at a time. And in addition, rather than waiting for people to get sick and treating them then, our job within the role of public health is to actually prevent illness before it even starts. So what does that mean? This means we provide guidance, we set policy direction, all with the goal of making sure that people in our city are able to start life off healthy and to stay that way for as long as possible. In order to do that, one of the key goals and objectives of public health is to actually regularly report on and assess the health status of our population. No different than what a clinician does in terms of actually providing tests, diagnostic tests, to form a treatment plan. A health status assessment actually contributes to a body of information that we at Toronto Public Health use to develop strategic goals and to support our mandate to improve the health of our community. And I can tell you that our recent health status report TO Health Check, which was presented to the Board of Health on September 23rd, is one such example of this kind of work. So we can go to the next slide. I will actually take you through a very, very high-level summary of this report. So in respect of the report, which seeks to tell a very high-level overview or story on the health status of Torontonians, the report groups selected health indicators into 11 sections, as articulated on the slide here in front of you. When we look at these health status indicators, we get a point-in-time picture of our population's health and the context within which people experience that health here in the city. As we go through the next few slides, I'll give you a very high-level picture, high-level summary of the indicators that are presented in the report to give you a sense of the topics that are covered, to tell you a little bit about the kinds of analyses that we did on the data that we have, and to provide you with some examples of the more pressing health issues that face our city. So turning to the next slide, overall, I'm pleased to tell you that Toronto is doing relatively well in terms of health and wellness. Over half of Toronto adults rate their health as excellent or very good, and life expectancy has improved in our city, and as you can see on the slide, life expectancy in our city exceeds the average life expectancy for the rest of the province. But you know, living longer doesn't mean that everyone actually enjoys optimal health. In fact, it's more common and becoming increasingly common for people to live with some form of chronic disease. We've just heard a little bit about that through the previous report. Diabetes, heart disease, and dementia are in fact increasing in our population, and this is due in part to the aging population. While chronic diseases such as cancer, diabetes, cardiovascular disease, and respiratory disease are the leading contributors to death and disability, we also know that Toronto is increasingly experiencing health concerns that some refer to as diseases of despair. These health concerns include such things as problematic alcohol and other drug use, mental health issues, and self-harm. As you can see on the slide, we do have some data in the report in respect of some of these conditions, whether we're talking about rates of emergency department visits for self-harm. These have increased. Suicide is the leading cause of death for those ages 18 to 39. Toronto adults are more likely to be hospitalized for conditions entirely caused by alcohol than for heart attacks. And in addition, the opioid poisoning crisis continues to be a critical public health issue for our city and has devastating impacts on members of our community. On to the next slide. Another key point that emerges from the report is that the experience of health in our city is clearly not the same for everyone. We know that there are health inequities in our city, and these are systematic, unjust, and avoidable differences in the distribution of health status between different populations. We know that people with lower incomes are at greater risk for chronic diseases. They have higher rates of unfavorable health outcomes for a number of indicators, and they have higher rates of premature mortality. I can also tell you that while many newcomers arrive in our city in good health, and they actually improve the overall health of our city, this optimal health is not necessarily long-lasting in this particular subpopulation. At Toronto Public Health, we have a mandate to address health inequities, and these findings, the kinds of findings that are outlined on these health inequities in the health status report, are a key area of intervention and a priority for us as we move forward in seeking to achieve our mandate. Turning now to our focus, turning our focus, I should say, to data on youth, the report raises some important points for our attention and, I would suggest, our concern. For example, Toronto has a higher rate of children living in poverty than other large cities in Canada, and Indigenous children, children from our Indigenous communities, are overrepresented in this group. Almost a quarter of children live in a lone parent family, with the majority led by a single parent, by female. Male youth in Toronto have the highest rates of emergency department visits for unintentional injuries. Looking further to some of the data, and these are also explained in this slide, a quarter of grade 11 and 12 students in Toronto report using cannabis. Half have consumed alcohol, and more than 1 in 10 report using pain relief pills without a prescription in the past year. These are just some examples of the kinds of things that we can find as we seek the data and look into the data regarding health status of Torontonians. And I think when we look at the data specific to youth, it's important for us, and it guides us in terms of the prevention of negative health behaviors and outcomes, because we know that when we can intervene early, when we can be successful in terms of changing the trajectory, the health trajectory of those who are young in our community, we actually are better able to support them into better health as they move into adulthood, and fundamentally become the primary economic and social supports for our older generation in our city and our younger generation. So wrapping up and getting close to the end of my presentation, there is so much more in this report, and I wish I could take you through the entire report. And for those of you who have extra time on your hands, it is about a 200-page report, but it is full of very interesting data that I think is of relevance to you as citizens and frankly to the police service writ large. We are, I would say to you, at a critical moment in our city's history. We have just come through a fairly significant federal electoral campaign, and in that conversation, as part of that campaign, there were many discussions around the choices that we need to make nationally, and yes, here at a city level, around what kind of community we would like to live in. And I think that in order to effectively answer those questions and engage in the actions and interventions that are necessary to create healthy and safe communities, fundamental to that is actually understanding our population, our demographics, the social context, and our health status writ large. These are the important questions that I think we really need to delve into. And I think this health status report provides an opportunity for us to start a conversation about the relationship between health and community safety. And as you can see on the slide in front of you, there are many questions, and these are just a few, that arise based on the report's findings. In closing, I would say that if the goal is to build and create safer, stronger, and healthier environments and communities that promote good health, then we have to start exploring our data together, health status data, and other stakeholder data, and asking ourselves many other questions. And I think that this is something we're more likely to be able to successfully undertake, to ask important questions, and more importantly, to solve those questions, to address those questions when that's done in collaboration. I can tell you that I'm very pleased to be here at this table. I think it's a marker of the kind of collaborative relationship that we've had thus far. I look forward to having further collaboration with both the board and the Toronto Police Service writ large, and I thank you for your time and attention. I'd be happy to take any questions you may have.
Thank you, Dr. DeVilla. Just before we get there, we do have one deputant on this matter, so if I could bring him forward and then get back to you, that would be terrific. Thank you very much. Mr. Moran?
My mom called me Derek Chairhart, and I just want to say I acknowledge and accept your oath of office. And remember the very last line of it, so help me God. You're literally telling God to help you. In Proverbs 1:10, my son, if sinners entice thee, consent thou not. So if Dr. DeVilla, if I look familiar to Dr. DeVilla, I was actually at the last Board of Health meeting. And I know this is going to sound like a shock, but I got into it with Councillor Cressy because he said something that's not true. He said that clapping's not allowed at those meetings, and you all know that's not true because clapping happened at the beginning of this meeting, and Vice Chair Mulliner didn't say anything about it. So I was there, though. Oh, so to point out for next time, Committee for the Commonwealth of Canada versus Canada, 1991, the Supreme Court of Canada said, on the other hand, expression in a municipal council chamber would be protected because expression is not incompatible with the function of the council chamber. So the reason I was at that Board of Health meeting was because I know somebody who wanted me to come down there and explain it to them and their friends there who are scared about this forced mandatory vaccination thing that's coming down the pike there. So they wanted me to explain to everyone there how the legal system is being used to scam parents into thinking that they have to get their kids vaccinated. I mean, it's their choice, ultimately. So one thing she might recall is I've been sending an email to Minister Christine Elliott. And the email goes, hi, Minister Elliott, and how are you? I'm emailing you in regards to the vaccination item at the Board of Health the other week at Toronto City Hall that has left a lot of people, especially mothers, really stressed out. And I wanted to ask you, as you are a lawyer, and this guy actually doesn't like me, he's blocked me on Facebook, but I asked her, Scott Duncan says that the crown is the surety for the person we all have. Is this true? And I've asked that question every week, once a week, for like the last 4 weeks for like a month. And it's just like, I don't know how to explain it. For some reason, Minister Elliott hasn't gotten back to me. It's like, well, must mean something I said. So the main act that seems to be used to scaring these parents into doing this stuff is something called ISPA, the Immunization of School Pupils Act. So I just want to point out that ISPA is one of those acts that lacks the enacting clause required of it by Section 6 of the Legislation Act of Ontario. So it's invalid and of no force or effect to begin with. So in the Immunization of School Pupils Act, there's a definition. Parent includes an individual or a corporation that has the responsibilities of a parent. Again, the maxim of law, in law, all definitions are dangerous. So I just want to point out to Dr. Davila that government and lawyers love to ignore the legal definitions of the words being used. So make sure if that you're one of these parents that you don't. In Cochrane versus Ontario Attorney General 2007, Superior Court of Justice, the Attorney General themselves suggested that the problem could be addressed by the better course is to read in the word means to replace the word includes. In the Legislation Act, individual is defined as means a natural person. Now, if you remember me mentioning that I spoke with lawyer George Rusty about the paper he wrote called Entering the Magical World of the Natural Person. In R versus Blairet, Court of Appeal for Saskatchewan, 2015, it said the law does not recognize the distinction between legal persons and natural persons drawn by Mr. Blairet. It turns on a notion of there being a difference between legal and natural personality, which simply does not exist. Cummings and Ontario Minor Hockey Association, 1979, Court of Appeal said, the only legal definition known to our law is the corporation. So this definition should really read, parent means a corporation or a corporation that has the responsibilities of a parent. Because in legal jurisdictions, anything to do with banks, money, government, legislation, lawyers change the definitions of the words being used to trick people into thinking that acts and statutes apply to the rest of us. As unfortunately, most people haven't read Section 32.1 of the Constitution, and even if they did, they still wouldn't understand it. Again, because lawyers wrote it in such a way that people couldn't understand it. And in the Child, Youth, and Family Services Act, there's a definition that says order includes, means, a refusal to make an order. Order means a refusal to make an order. So I want Chief Saunders to remember that, and in the future, if any of his officers have to go to these with a CAS agent, that definition is basically a bluff. It's the same as Denzel in Training Day holding up the Chinese takeout menu saying, I got a search warrant.
Thank you, Derek. Your time's up. Any questions? Any questions of Derek? No, seeing none. Thank you very much. Dr. Davila? Members, any questions of the Medical Officer of Health? Ms. Chandra-Casera?
Thank you. Not a question, more of a comment. We spent a lot of time on this board in discussions with the chiefs about the root causes of violence. And I think it's so great to have you present because there's so much overlap between criminogenic factors and the barriers to the social determinants of health, as you kind of outlined today. So I think it's really important that we continue to hear from you, especially about the challenges you're facing, because those challenges often end up being trickled down to public safety and policing. And so thank you for that. And I also really want to thank you for dedicating your time to be on the board's Mental Health and Addictions Advisory Panel. It's going to be so great to have your advice and expertise at that table.
Thank you.
Any other questions? No, seeing none, I just have a comment. First of all, I'd like to thank you very much for coming here today. And I understand that we're going to see you perhaps once a quarter. And you know, our work here and your work has lots of overlap. And I'm sure that this board will benefit greatly by your advice and counsel. And I want to thank you and your staff very much for all the work that you do. Oh, Mayor Tory.
Just going to ask a question because we don't have you here very often, and I was talking to the media outside today, and I think when you mention these things, they're out of context to some extent, but I said that the last report we received as a board indicated that the overdose related police calls were up 34% so far this year. And I just wondered if you'd just spend a minute putting that into the context of what's going on. You had referred to in your presentation the 308 people who lost their lives to overdoses last year, but maybe you could just put this into context, because it has a huge relationship, as I was mentioning, to policing, you know, as well as to the human toll that it's taking. And I wonder if we could just talk about that for 2 minutes, because I know you don't get perhaps as many chances as you might like to talk about how serious this is.
Yes, so thank you very much for the question. I'm sure it doesn't come as a surprise to those around this table or those of you in this room. I've actually referred to the opioid overdose crisis as one of the defining health issues of our time. Certainly, it is taking a number of lives throughout our city, and that's not an experience that's unique to us. It's something that we're seeing throughout North America. I regret to inform the board that here, the Toronto Police Services Board, that the numbers are not yet going down. We are seeing some degree of stabilization, but I can tell you that in Canada, unfortunately, the opioid overdose crisis is the number one cause for death amongst young people. We know that a preventable cause of death, the opioid overdose crisis, is right up there. And unfortunately, these diseases of despair are continuing their march across the country. We know that opioids figure prominently here in the city of Toronto. Unfortunately, there are other substances, and I would imagine that members of the police service are quite familiar with that which is happening and the substances that are actively being traded and sold on our streets, and the negative impacts that has both in terms of safety, community safety and well-being, and with respect to preventable death. What we are working on right now, actually what has been very much the focus of our Toronto Drug Strategy team at Toronto Public Health, is working with our healthcare partners on trying to facilitate access and pathways that allow for those who are increasingly presenting to harm reduction services and indicating that they're interested in pursuing treatment. We're finding that those numbers are there. However, our challenge is that our healthcare system doesn't seem to be able to have the room to take people in. And I do believe that this is one of the major areas in which public health and healthcare need to work on more collaboratively, so that we can actually create healthcare pathways that allow for a viable route forward for those who are prepared and ready to seek treatment. So I'm hoping that at some point, we're just in the very early stages working with academic health science partners on this issue. I am hoping to come back on a regular basis here to this board to inform you on what's happening. And my hope is that we'll actually be able to look at our data in respect of health status, along with your data, again with all the appropriate caveats and protections, to understand whether in fact our health pathways and opening up health pathways has some positive effect in respect of that which you're seeing when we look at data on community safety and well-being.
Thank you very much. Board members, anybody else? Can I have a motion to receive the presentation by the Medical Officer of Health? Councillor Nunziata, seconded. Marie, thank you very much. Thank you.
Thank you.
Now we can move on to item number 6. Item number 6 is the process for reviewing the 2020 capital and operating budget requests. Members, do you have any questions on that report? There's a motion before you on the screen right now. If I can read it, I can now. Okay. Now I can't. The motion on the screen before you is that board staff change the following words on the first paragraph under the subheading discussion on page number 2 of the report. It is proposed that the Toronto Police Service Board establish its budget committee in October 2020 in order to engage in a process to review the capital and operating budgets and to replace that with October 2019. Could I have somebody move that amendment, please? Marie, somebody second it? Hoopla. Can I have somebody move the report? Marie, Hoopla, all in favor? Opposed? Carried? We had to change it to 2019.
Do we have to appoint members at this time?
Yes, the report says the chair and the vice chair within the report itself.
Okay. But I thought that we wanted.
And if there are any other interested
No?
parties, they can certainly come forward and speak to me about it. We did, but we'll talk about that offline. Now we're moving on to item number 8, which is special constable appointments and reappointments, October 2019. I actually held this item. I have just one question of staff. Does anybody else have a question on this item? Members? On number 8, I don't believe is there a deputation? I believe that deputation withdrew. Yeah. That was the one you said wasn't on. Right, but it's not. Yeah, I believe that deputation has withdrawn. So item number 8, I just have one question of staff. On page 2 of the report, under agency, it says TTC, and it says approved strength, and there's no number. I assume within that establishment that there would be an approved number. I'm just wondering if you have that.
I think the approved number is somewhere around 91.
So
the approved number is 91.
For any future report, I'm sure you'll include that.
Absolutely.
And just a soft kind of recommendation for future reports, I would recommend you change approved strength to perhaps approved complement, just for tone.
Will do.
Okay.
Thank you, Chair.
Very much. Any other comments from members? Can I have somebody move the report? Mayor Tory, somebody second it. Marie, all in favor? Opposed? That's carried. Thank you. I believe we're moving on to item number 12. Is that correct? And that's the City of Toronto Council Decision Road Safety Plan. Any questions from members? On item 12? Councilor Nunziata, do you have a question?
So this was moved to committee and with the recommendation. So
We have a motion on the board that might answer the question I think that you're thinking about.
Oh, okay.
Are you okay with that, Councillor?
Yeah.
Any other questions from members? So the motion on the board requests the chief to report back here to the police board.
And my request is for at least 2-month delay, Chair, for the response.
Sure.
Thank you.
There's no urgency to that. Thank you. Can I have somebody move the report? Councilor Nunziata, second. Upla, all in favor? Any opposed? That's carried. Thank you. I believe that's the last item. Can I have a move? Can somebody move adjournment? Mr. Mayor has something? Mr. Mayor has something? Come on. I think I've got this. I think I've got this. I think I have this one. Mr. Mayor, you want to move adjournment? I think you should, yes. Okay. Somebody second it? Ray, thank you. All in favor? Opposed? That's carried. Thank you very much.